Are you ready to jump into some true crime docs, crime thrillers, and more? Check out our website for an extensive list of our favorite movies and shows at thesirenspodcast.com/whatwewatch and find our favorite true crime and thriller books and authors, some covered on the show, at thesirenspodcast.com/author alley. You can even find special deals for Amazon Music, Audible, Discovery Plus, Paramount Plus, Showtime, and even Grubhub. If you're looking to jump in immediately, check out our pinned Facebook post for some streaming service free trials on us.
You're listening to Sirens, a true crime podcast brought to you by the Sirens Network. This podcast contains explicit content, so listener discretion is advised. The opinions expressed on this podcast are solely the views of the hosts and do not reflect the views of affiliates, associates, or sponsors of this podcast.
This is Sirens,
a true crime podcast.
Let's move on to Jerry Summers, February 2012, and this was his best friend.
That's his friend.
Yeah.
Okay.
Jerry.
This I know about.
Jerry,
So
yes.
sad. I know.
So Jerry was his best friend in high school.
Oh.
When he moved off to college, they didn't keep in touch, but when he came back, they got back in touch and they, let's just say, partied a lot together.
Was Jerry his drug dealer?
Jerry was a known drug dealer from way back. He was the guy.
Oh, Jerry.
He was the guy to get it from. And because they were little best friends,
Give him a discount, or
he was getting him a discount.
Oh, man.
Yeah. And Jerry was also his hype man.
Oh,
right?
shit.
Yeah, that was the thing about it.
In a
Seriously.
very
Hardcore.
sad way.
Yeah.
Yes.
A very sad
Yeah.
way.
Seriously would go to bat for him no matter what.
Well, I mean, that's what best friends do, I guess.
Yeah.
After I can't say
I
that
don't
anymore.
believe it went the other way, though. I don't think. I mean, we know what happens to Jerry.
I don't
so-
know what happens to Jerry.
All right, well, I'm
I
about
don't
to
know.
tell you.
I don't know
Well,
any of this stuff.
the
I'm
doctor
gonna
was
tell you.
not his hype man. Okay, did not help.
That's
him.
true. His girlfriend, Megan Kane, they all came to Plano. He came to Duntsch to have 2 neck vertebrae fused. He had a car accident where he rear-ended somebody and it left him in constant pain in his neck. He went under the knife this was elective. Like, he just had pain. And Duntsch said, hey, bro, I can fix that for you. Like, I'm the best.
I got you,
obviously. Yeah. And so he was like, well, I mean, he's the best.
Around?
So around, yeah. So he went to him to have this surgery. It was a spinal fusion, elective. I want everyone to remember it was an elective surgery. Before surgery, his anesthesiologist on that case asked him if he needed anything for the surgery. She asked Duntsch if he needed anything for the surgery. Anesthesiologist, just being cool, man.
What do you mean, like a pick-me-up? Or do you
So,
mean like tools?
if he needed anything specifically to be done with the patient,
Oh, okay.
like during the surgery. He said, and I quote, nope, I could do this surgery with my eyes closed.
Gauntlet laid.
She also mentions that during the surgery, he was extremely distracted. He was constantly hitting on his surgical assistant.
Like while he was doing surgery?
Yes.
Oh man, and Megan
What
was
is
his
the
girlfriend,
surgical equivalent of a burnout? Like, pull up to some girl at the street. What's up, baby?
Hi, girl.
He just...
That makes...
Jeez.
I don't want no scrubs. Take a whole other...
But
How long you been sitting on that?
A while.
It's good. I liked it.
I liked it a lot.
Yeah.
So she said it made her so uncomfortable that it was one of the most inappropriate conversations she'd ever overheard in an OR before.
That blows my mind.
And remember,
Like you're at a restaurant cutting a steak, talking to a girl, your date.
No, it's way worse than that. Like, I mean,
is it?
it's
Jesus
worse because,
Christ.
number one, it's public and you don't care who's hearing it. Number two, he had a girlfriend at home with his kid.
I keep forgetting he has 2 kids at this time, correct? That's
He's got one.
He's got one
At this time, he has 1 child.
Oh, okay.
So
still, though.
The anesthesiologist then recalled that during the course of the surgery, Jerry Summers starts to lose blood. Okay, and again, Duntsch is ignoring the blood loss.
It's not funny. I'm sorry.
Hey, your best friend's dying. Shh.
I picture while all this is happening, like him leaned on the body, looking at old girl. Like, what you doing later?
Sir, your best friend's blood pressure's dropping.
Don't worry about him.
Yeah, and so he's ignoring the blood pressure drop again, to the point where over the course of this surgery, Jerry loses 1,200 milliliters of blood.
Woof. Liter.
How much blood do you have in the body?
6 liters in the human body.
Okay. So during a surgery, typical surgery like this, you're only supposed to lose around 50 milliliters.
Oh my God.
He lost 1,200. And that's like more than 1/5 of his blood volume. It's like 24 times the typical amount of blood loss in a common spinal fusion.
What happens to a person when they lose that? Like, say you come up on someone and they've lost that much blood.
Bleed out, you're dead.
Well, no, not at 1,200. Not at 1,200. At 1,200, you go into compensated shock. So compensated shock is the body recognizing something has happened to it and trying to fix it. You are compensating, and you're in shock. So usually that activates the parasympathetic nervous system. Well, that seems a little hot. Let's get that part out. It makes your blood vessels constrict. It tries to raise your blood pressure by elevating your heart rate. It shunts all the blood to the central trunk, like to protect the vital organs. It pulls everything in from the fingertips and stuff, so your perfusion of oxygen.
And if the trunk is open, what then?
Well, you got to remember,
the trunk is open in surgery.
Yeah, I guess
it would be different.
Yeah,
it's a lot different because the patient's sedated. The patient's more than likely airways being controlled by an intubation or something like that. So he's got a tube down his throat, and everything's under control. And then when you notice that much of a blood loss, most likely what you will see is the amount of blood that's coming out of the body, especially, I don't know if he hit an art line or not, like if he hit an artery versus a vein. Veins they don't bleed as much, but if you hit an artery, it bleeds like crazy. The pressure is intense. I wonder if, of course, I've never been in a surgical situation where this has happened, because Jesus Christ, like I said, usually 50 mLs over the whole surgery. Yeah. That's it.
Yeah.
They have the tiniest little suction thing they set down in there, and it pulls it out while you're working, keeps it out of your way. 1,200, that would, oh my God, they would have had to change the container.
Yep.
I just thought about that. Containers only hold 750 to a liter.
Yep.
So they would have had to take, they would be like, hey, this is full, and like switch
constantly,
it out, get a different one.
Yeah.
That's nuts to me. All right, anyway, so the other thing is that I wonder if it literally fountained, because the heart rate would have sped up, the pressure would have increased,
and
the
remember,
actual blood pressure, it's
coming out of the neck.
It goes up before it goes down.
Oh yeah.
Yeah.
Yeah. Your blood pressure always spikes in a traumatic injury before it dips out. Because you're compensating. The other side of that is the decompensated shock. That's when it goes, fuck it, we're dead. And everything opens up. Like the blood pressure bottoms out. The heart rate slows way down. All the vessels get bigger. And so it had to have been like fountaining.
So I know that you're not a surgeon. Nobody here is a surgeon.
No, we're not.
However, when bleeding starts in surgery, they're supposed to stop and immediately address the bleeding.
Correct.
When they address the bleeding, they're supposed to fix where it's coming from.
Correct.
Okay.
Hence all the clamps that you have on the surgical table. Clamps go over arteries.
Yeah. So he ignored the bleeding. He did not fix anything. He didn't. I want you to think about this. He didn't fix anything before he closed him up. He instead filled the entire neck area that was open with anticoagulant gel foam and closed.
Well, no, why?
I'm sorry, with anticoagulant gel foam.
Yes.
He filled the surgical cavity.
Yes.
Just so everyone knows, that means you cannot make clots. He did not address the bleed and then filled it with a foam that would not allow it to clot.
Yeah.
And then told someone else to close. That is
What
murder.
the-
That is murder. That's murder. There's
What
no
the
other way to
hell?
describe that.
So that
I mean, maybe he just wanted to see what happened.
that gel
Fucking
foam,
maybe he did.
that gel foam that he put in actually further restricted the spine when he was closed.
Oh my God.
So, yeah. Okay. So what had actually happened in there is that he had removed so much of the bone, and he had severed some parts of the neck and the spinal cord, that Jerry was pretty much almost decapitated during this surgery.
Oh my God.
Why? I have to stop and say why. Why in the fucking Christ was he cutting anything? This is a spinal fusion. If you don't know anything about surgery, he is putting two bones together.
Right,
Yeah.
right.
Why are you cutting anything?
He removed a bunch of stuff out
I
of
can
it.
understand prepping part of the vertebrate to be ready for hardware installation, like if you want to
Plates or
shave
screw-
off
yeah.
a bone or
Yeah.
a spur or something like that that's going to prevent your plate from
Right.
fusing clean. But I cannot fathom why he would cut enough to internally decapitate.
He cut parts of the spinal cord.
Curiosity.
Jesus goddamn
I cannot.
Christ.
Do you really think that it
Stress
was
this enough.
curiosity, or do you
100%?
think he was trying something?
Yeah, I think he just wanted to see what happened. He didn't care what happened to the person.
So you think he just started going and couldn't stop?
Yeah, I think he can't. Yeah, I honestly think he just couldn't stop.
He was like, "You're about to cut the spinal cord," and he was like, "Fuck it, do it." You think
Yeah.
that
I read-
he's
No, no, no.
that-
I agree.
You think he's that far
Yes.
gone?
Yeah.
I agree.
Holy
Yeah.
Jesus Christ!
And he
Well,
just
I
kept
mean-
wanting to do it, but it's like he couldn't.
So would the
Think-
foam then be
That's
like
why
his
it's like he did something
impatience?
different
He
every
would be
time.
like, "All right, my curiosity has been
Yeah.
It didn't do what I
Satiate,
wanted it to
yes,
do.
yes.
and so
Yeah.
like let me just get out of here as
Just-
quick as
I'm
possible."
out. Yeah.
Yeah.
Because if you think about,
Jesus
let's
Christ.
just look at people like H.H. Holmes. He had some medical knowledge, and that's what he did. He was literally experimenting
Yeah,
on people.
But that's psychotically playing with the body in the dark corners of your
He
murder
wasn't
hotel.
playing with a body. He was snatching people and doing this to them while they were alive.
All right,
So it's the same
It's the
thing.
same.
I'm out. That's fucking banana bread.
Most of the time, these people are geniuses. You
Yeah.
know?
Jesus
So
Christ.
it just
Like too
instead of
smart
us-
for their own good. They have questions that needs to be answered right now, like this. Yeah.
That's nuts to me.
So-
That's nuts.
So after surgery, Jerry was so unstable, his head was almost falling off his body. He was so unstable that when the staff would ever try to move him, like even to another bed, another position, whatever, his heart rate would plummet, and they would have to completely stop touching him.
So he severed the spinal cord completely from the brainstem.
I don't know if it was completely. I know that he did
Enough damage to
enough damage.
to do away with his baroreceptors and chemoreceptors. He can't regulate his own blood pressure. He can't regulate his own heart rate.
So the nurses and other staffers who took part in the surgery and the aftercare, they fully expected Summers to have a revision surgery almost immediately because he was so bad. He was in such bad shape. Other doctors note later that it's critical to reverse damage of this sort, like within hours.
Instantly.
Yeah.
You have to do it right now.
Duntsch refused to do a revision surgery.
In fact, the only time that you should wake him up is just to assess how bad it is. Mm-hmm. Like you just wake him up and go, "Hey, wiggle your feet." I can't. Wiggle
Yeah.
your hands. I can't.
Yeah.
Where does it hurt? Okay, knock him back
Back
out.
to sleep.
Yeah.
Sleep time.
and he refused to do the revision surgery.
How long was he left before anyone opened him back up?
Another doctor came in later and tried to repair the damage with another surgery, but too much time had passed. Too much damage had been done, and Jerry was left as a quadriplegic with incomplete paralysis. This means that he could still feel pain. He could still feel everything. He just couldn't move it. Yeah.
That is a fucking nightmare to be trapped in your own body while it's on fire.
Yeah.
Yep. Yep.
Jesus
And this
Christ.
is his best friend. Supposedly his
Be like,
best
if I
friend.
killed Bill.
Don't kill Bill.
Oh no!
Well,
But I lied to you about it first. Like,
Yeah.
I got you, Bill.
Yeah.
The second he's out,
They
cut his head off.
also like have antisocial personality disorder, you know. So like they just don't really know how to make connections with people. Like Jerry thought they were BFFs, but he just thought, "You're my drug dealer, but I'm also going to experiment on you." You know?
So to him, that was a guaranteed victim.
oh my god, yeah.
Oh yeah, for
That's all
sure.
it
I
was,
know
but-
that I can get Jerry to
For
agree.
sure, yeah. Because Jerry wasn't just his best friend or his drug dealer, but like he ran parts of his clinic. He did PR stuff for him. Like he was his hype man. Yeah. So
how hard would it be from Jerry's point of view to recognize maybe I shouldn't let this guy do surgery on me, or maybe he's exaggerating how good he is at stuff? Like if they were friends since high school, right, or college? Like
since high school. Jerry
obviously had his own problems. Okay, did they really do drugs before the surgery?
Okay,
together?
so that's the thing. He kept requesting Duntsch to come speak with him after the surgery, even after the revision surgery, and Duntsch wouldn't come see him. It got to the point where he wanted answers so bad that he felt like, and this is the first time Baylor had heard of any kind of drug use, but he actually told one of the nurses that he and Duntsch had done cocaine the night before his surgery.
But they didn't test his blood. Would they even be able to still see cocaine in his system? They would, right? I think it's like 3 days, although he had lost all that blood.
I don't know how long it had been after the initial surgery.
Oh, right.
Because I know that he didn't come to see him for like a week or so. Like he just left him there in someone else's care. Like that he handed him off to this other doctor who did the revision surgery, like transferred care to him. That was it. He just never came back. Never came back to see him.
Well, he's done with him, right?
Yeah, he's done. Yeah, he's done with him.
And Jerry's got to be his swan song. Jerry's been his longest running victim on the back burner. I've been waiting on Jerry to let me cut his head off for years.
Yeah.
Sick.
And now Jerry let me do it, so I'm done.
Well,
Boom.
and
See, Jerry.
they did give Duntsch a drug test, but I think that maybe too much time had passed when they gave it to him. But he did pass that drug test.
I don't think Jerry would recognize any of the red flags. Jerry had his own issues. I mean, he was an adult drug dealer. So when you're a drug dealer, I don't think you have a lot of close friends. People kind of hang around you that are also kind of...
They want something
from you. Then he has a friend who actually has money and doesn't really need him, or so he thinks, you know. So he'll do anything to stay with him. He wouldn't notice anything. He just wants a friend.
Yeah.
It's really sad.
It is really sad.
Those people are out there.
I guess you got a good point.
Yeah. So despite passing the drug test, Baylor Plano officials, they were concerned enough to force Duntsch on leave pending a peer review because it was such a bad one, and it had just been one after the other.
Jerry's number 4 or 5?
Jerry is number 4 at this facility.
Okay.
Yeah.
And I assume there are more cases, which blows my fucking mind.
There are more cases, yeah. Yes, so while Duntsch was cleared to resume operating while the review was underway, which I don't know how, but anyway, hospital officials asked him to limit himself to minor surgeries only until it was complete.
I can explain that one. I can explain why they still let him. Because if they yank him off of the table, he's not being paid, and surgeries are going out of the rotation to other doctors that could have been his. Yeah. Mm-hmm. So, in the appeal process, if they're wrong, they had to pay the doctor that did the surgery, but they now owe that money to Mr. Duntsch as well. He can counter-sue, and they have to pay for those twice. So
lawsuit.
They don't yank him off the table. They say, hey, let's just do some kneecaps or something. You know, maybe do some toes that don't murder people. Let's just keep it low-key.
The politics behind
you keep working.
Gross.
Yeah. And it won't be a blimp. Maybe everybody will think you took a break.
It just seems so weird. Like there are rules in place that like what are some of the rules? You can't sue your doctor or something
yes, they
like
protect
that,
doctors more so than the patient.
They really do.
They have these, I don't agree with that rule, but they have these rules that they just put in place. So why can't one of the rules be like, while you're under review, you don't do surgeries, you can't countersue, blah, 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 blah.
Well, because then if they just, again, politically, if I just didn't like you and I ran the hospital.
But it's not just one person, it's a board, right?
Oh, 100%. But if the board doesn't like you.
Who makes up the board?
Yeah. I mean, people make up the board. So 2 people don't like you. That's 2 votes. All right, you're under investigation. And the whole time you're not allowed to work. And that's an easy way to run a doctor off that just disagrees with the board.
Yeah.
Because he's not going to stay here working with you while he's not making any money. He's going to go make money. Go to another hospital.
Yeah.
where they don't put him under review. Every single time he comes off review, they put him back under review, and he never makes any money.
And apparently it takes some time to get records from hospital to hospital, which
and it
doesn't
consolidate
seem like
any medical health
it
records
should,
are.
right?
And the thing is there is the NPDB. It is the National Practitioner Data Bank. Okay, so that is where you or I, as lay people, can just jump online and check someone's medical license.
Oh.
We can check it. I mean, we can just look it up and check it. We can see who they're working for. We can see if their license is still active, how long it's been active, and if there's any actions taken on that license.
Are there reviews like Angie's List?
Yeah, I'm going to get on there and I'm going to leave you a review, Bill.
1 star for Bill.
Actually, we're going to talk about that.
Me paralyzed.
We'll talk about that later. But then there's also the medical board. Okay, so the problem is it has to go through the medical board to go to this online data bank in order for anything to be flagged. So when he goes and applies to another hospital, no one has complained about it. So there are no flags on the data bank, and that's what they check. So there's no complaints. There's nothing on him. Oh, he's clean. So yeah, let's hire him. For like it's
Makes
Can I ask you? You two probably know. Do surgeons get drug tested? I know you said they drug tested him after he got,
Employment
complaint,
screening
but-
is mandatory for every medical
now.
professional.
Yeah, now
mandatory.
Is it
I don't know if it
good
was
then?
back then.
In fact, randoms
really
are
wanna
usually
know.
written into every single
Good,
contract.
awesome.
Yeah.
Mine has randoms written into it, so they can call me right now and say you have to get up from on your day off. You have to get in your car right now and come to work and pee in this cup, and you got to do it.
Oh, you work too much.
Or
They
they
should
will
just make you do it
yank-
at work.
Nope, because they don't know. I mean,
You can come home and do drugs. I get it.
well, like cocaine is a 3 to 5 day lapse, right? So if they thought I did it on Wednesday, and it's Saturday, they got to get me in today
They gotta
because
do
by
that.
Monday it'll be gone.
Oh, good point. Good point.
Yeah,
Okay.
true.
They don't. I trust you, buddy.
The sad part is that Summers did remain a quadriplegic for the rest of his life.
Is he not? Is he not alive anymore?
It can't.
He passed away in 2021 of an infection related to all of the surgeries and all the complications.
What was he in his 50s, 40s?
He was, I believe, he was in his 40s. Yeah,
Jerry, man.
I count this as a murder.
Murder. Yeah. Straight up
Yeah.
murder.
Yeah.
I'm sad about it, but yeah.
Yeah, I'm not feeling great.
It's hard to imagine that there's more patients, but yeah. So the next patient was Kelly Martin. She was 55, and this is March 2012. So this is only
Oh my God, that's
3 months.
months
That's
after
3 months.
Jerry.
this is only 1 month after Jerry's surgery.
Jesus.
Jeez. The review board had already been. That was already done.
It was
whole-
it was pending investigation. So this was remember, he was put on basically light
Right.
duty. This next surgery
It's
was
not-
supposed to be a minimally invasive spine surgery,
Oh, okay.
but it didn't end up that way.
And
I would
just
at
to
least take
clarify,
them off spines.
Yeah, get him the hell out of there.
Right.
Yeah.
well, usually what they're doing with these minimally invasive spines is they'll have like, you'll have like vertebral swelling. All right, so like the vertebra itself, the little, whatever, the cartilaginous pad, the cartilage that's in between your spine bones, those will swell. Or you'll have a spur come off the vertebra that touches the nerve in between the cartilage and that's no big deal. You go in there, grind it off. I mean, minuscule little stuff like they make an 1/8 of an inch incision,
hardly
and
an
run through
incision,
and go, you're done. So I'm up.
That's
and that's
minimally
it's like
invasive.
2 stitches in a button pattern, and they let you leave.
And I am going to say this next surgery is considered minimally invasive. And it is a very common surgery. It's called a laminectomy. It's a procedure where the posterior arch of a vertebrae is removed. So a part of the vertebrae detached from itself, and it tore off, and it started pressing inward on her spinal cord, on the nerves. Okay, so the part that is detached simply needs to be removed.
You just pop
That's
that bad boy out of there.
And the posterior means that it's behind you. It's just this little back part. Just
They
a little,
won't go in from the front.
Oh my
no,
God.
they won't.
Not this time. Not this time, Bill.
Okay, so
Well, then they need to make a new game. I'm going to tell you right now. Making people like me look like idiots.
You make people like you.
So Kelly is moving stuff in and out of the attic with her husband, and she falls from the attic.
Kelly.
I know. And
no.
and ever since then, she had really bad back pain. She sought out surgery to alleviate it. In the MRI, it was revealed that she needed this laminectomy. So her husband of 45 years, Don Martin, and a retired police lieutenant, dropped her off that morning, and he said, quote, Kelly even asked Dr. Duntsch, have you ever had any bad outcomes or deaths on your surgeries? And he said, no, knock on wood.
Oh.
Jesus Christ.
I don't like that at all.
Oh, not. Am I right? Anyway, take your pants off.
Stop crying.
Why? That's so horrible. So then during surgery, again, we're seeing a pattern here. She begins to drastically lose blood pressure. Again, it is ignored. She has actually suffered from a major arterial injury during this routine back operation. He refused to abort the surgery even after a trauma surgeon colleague and an anesthesiologist warned him about the blood loss. So then Dr. Death updated the family. He kept going out and updating the family because the whole family was there. Her husband and her 2 daughters were there waiting. And so he would go out and update them every now and then, be like, oh, it's going great. It's the best surgery I've ever done. All of this.
Every time with more and more blood on him.
Yes.
Everything's going good. Don't go
Why
back
would
here.
the surgeon go update?
That's pretty common, actually.
Yeah, it's pretty common.
Why
Yeah.
would you not have an
Well, because let's say, for example, he does
need
nick
a
an
break.
artery. All right, so it can happen. It shouldn't in a laminectomy, by the way. If you have any skill with the blade whatsoever, you should not nick an artery on a laminectomy, and I'll explain that in a minute. But if it does, then the surgeon himself, who has done the thing, he's like, hey, we've got to bleed, and then he'll back out, and our boys, the vascular surgeon guys,
Right.
they'll come in,
Okay.
and
Right.
while they're
that makes sense.
they're
Then he'll
fixing
go
what
out,
you
yeah.
fucked up, and he'll go, all right, I'll just go tell family it's going to be another 45 minutes while you do your thing.
Exactly.
And then
yeah.
you go pop the door open with your elbow and go, hey, I nicked her artery. It's never deal.
Yeah.
Whatever.
And even
Okay,
sometimes.
I was thinking all right, everyone take 5.
No.
Go update.
That's,
Gross.
no. Yeah, it's like what he said. And
I need a
sometimes
Mountain Dew.
a lot of the times the surgeon that you need, if it's a vascular surgeon or whatever, he's not just hanging out in there. He has somebody call and says, oh, call for vascular, and then they'll come in and then they'll fix it and so on and so
Unless it's way more major.
Yeah.
But not for this.
Yeah,
For this
no.
minor thing, vascular wouldn't have been called in.
So I'm not sure if that happened. I do know that he left and he updated the family several times. The entire time, though, he refused to acknowledge that this massive blood loss. They have no idea where the blood loss was coming from. He in no way tried to fix it. And he simply closed her up and moved on with his life.
And that makes me wonder if he's just keeping up those appearances when he does that. I should be done by now, so I'm done.
Well,
This
didn't you
is how
say there
long it
was a
should take.
trauma surgeon in the room that told him about the blood loss and tried to stop him?
This on a separate surgery, yeah.
No, I thought that was on this
surgery.
one.
I
No.
thought you said the anesthesiologist and a trauma surgeon tried to tell him to
Yeah,
stop,
I
and
got
he ignored
confused
them.
about that too.
On
They
the
warned him.
laminectomy?
Yes,
Yeah,
they
okay.
did warn him about it. So the trauma surgeon must have been the one that was in the room when he went and updated.
See, that already tells me that they're super not confident in his ability to do it. A laminectomy is, you've seen pictures of a spine, of a vertebra, right? It's got 2 fins on the side, come out, and you got one on the back. And that points, those are the bumps that you can feel on your back, is that guy. So in a laminectomy, it's the back of the bone that is touching the spinal cord,
Right.
the spinal canal.
Right.
So in that, they're just literally going to take your round, beautiful little disc and just cut that fucking section
I
out.
have a feeling because he was on restriction that the other surgeon was probably required to
babysit.
be there.
Yeah,
Uh-huh,
yeah, probably.
And
I
that
think
is
that's
the
why he
hospital
was there.
protecting their interests.
Yeah.
That tells me that they
Again.
weren't confident. Because that should be easy peasy. Open them up,
But
3 or
if
4
the guy
cuts, pull it
didn't
out.
do anything,
well-
he was pointless to be there almost.
And to what you said, that you didn't think they were very confident in him, well, here's the deal. They actually had an ICU team on standby.
Oh my God!
For a
Well, thank
fucking
God.
laminectomy?
Yes.
Thank God that
Yes,
Yeah, they still
because
let that
because
happen
they
to her.
reported, I guess either the trauma surgeon or the anesthesiologist had reported that there was massive blood loss, and they just got an ICU team ready. But Duntsch would never let the ICU team get near her until he was completely done.
Well, yeah, think about that. That's like, if you're taking the alternator out of a car, and I had a manufacturing team standing behind you. You're not going to let them, I do not need you people. That's how you're going to look at it. But that's because you're competent enough to take the 3 bolts that hold an alternator on off your thing.
Not just that,
That's
you have a God complex, so you're pissed.
Yes.
You're furious that these people are in there babysitting you.
Yeah. So when Kelly Martin woke up from anesthesia, she was screaming belligerently.
Oh my God.
She was clawing at her legs. She was in so much pain. The ICU team was actually forced to re-intubate her and re-anesthetize her.
Jesus Christ. Said put her back down.
baby.
Put her back under.
So what did he actually do back there?
So Kelly Martin's legs were covered in white and pink splotches, according to the ICU team.
Why would that happen?
Distal perfusive issues. So
A sign that she was bleeding somewhere.
Okay,
yeah,
gotcha.
she's losing blood
That he did not fix.
that he didn't fix.
And they assumed, because she was so bad, they assumed that he would be taking her back into surgery
Again,
really shortly.
Immediately.
Yep.
So was she aspirating, like right there on the tape? Is that
No,
she
she wouldn't have been aspirating. She just would have been internally hemorrhaging.
Yeah, internally.
A lot of people don't know this, but your pelvis alone, just the space in between the bottom of your organs and your perineum, which is the skin in between your butthole and your other part.
Yum.
The taint.
Jinxies.
So, anyway,
These guys.
that little cavity of your pelvis can hold the entire volume of your body's blood.
What?
Every
Yeah.
bit of it.
I am
Every bit of it.
astounded. That's awesome.
crazy.
That amount of space can
Wow.
hold 6 liters. 5 to 6 liters is what's in a human body, between 5 and 6. And that space can hold all of it.
She never went back to surgery. As a matter of fact, they waited around so long that she went into hemorrhagic cardiac arrest.
I can tell you this: cardiac arrests for a medical issue like a heart problem or a chemical imbalance, those have the highest success rate. Volemic cardiac arrests have less than 1% success rate.
So
In the best cases where you have blood on hand to put back in the body that's type matched perfectly, ready to go, 10%.
And did she live?
She did not.
Murder. There you go. There's no possible part of that surgery that involves cutting a vessel.
Yeah.
No blood vessel should ever have been cut. Bone only.
Why did they wait so long before going back to surgery?
Well, because Dr. Duntsch was standing 10 feet away from them.
Oh, and basically
And they were
yelling at
waiting
them.
on him to give them some sort of,
Go
tell
ahead.
me what to do. And he was just standing there until
Because remember, they can't do anything without his go ahead.
Until,
this is his room.
Yes.
Okay.
Until she went into cardiac arrest, they begin working on her, and he still just stands there. Literally, lights going off. That's what happens in a hospital room. Lights go off. There's all kinds of people, nurses running in and out. He's still just standing there.
They have a crash team, a
Yes.
crash car. They
Yes.
call over the PA for the entire hospital.
Yes, they do.
The
Yeah.
code, which is a code blue,
Yes.
and the room number. They do that because Dr. Duntsch isn't her only doctor.
Right.
She has other doctors that have been doing her care this whole time. So you might be in an ICU room where you have several doctors that know your case very well.
Yeah.
That doctor might be at lunch. So they say, hey, code blue on, room 111,
Yeah.
and that's my room. I got to get the fuck up there. My
Right.
dude
Yeah,
died.
yeah.
So, yeah, it's a nightmare, man. A code blue in a hospital is hectic as fuck.
So all of this chaos is going on, and he's standing 10 feet away at another patient's room, and he just is doing paperwork, just like so calmly, watching them all come in and out of his patient's room, and he never goes in, never checks on them.
What is that?
never?
What the hell?
What
Yeah.
is
He
that?
doesn't care if she lives
He
or
doesn't care.
dies.
No.
So he's completely detached
Yeah.
from all humanity.
Yes.
Holy shit.
Yes.
So he didn't even, because like I said, the family was there waiting. He wasn't even the one that told the family of the loss. The pulmonologist went out and told the family.
The lung doctor?
The pulmonologist.
And
Yeah.
he had already been on there several times and looked at his family in their eyes and then
And
went
said,
in and
"I'm the
killed their
best."
mother.
Yeah.
But it's just so...
Yep.
Well,
Those people can't be, I mean...
was he seeking an egotistical or narcissistical release when he goes back out? Like, do you think that was it? Because if we
He
think
didn't
about it
face
now,
the
there's
family.
really no reason. No, I meant before.
He didn't.
When he would come
Yes,
back out and say, hey, it's just going to be another
absolutely.
couple minutes. Don't worry, I'm the fucking best.
Yes.
Yeah, absolutely.
That's for sure.
What the fuck
So he was
is
just
wrong
going
with
out
this
for
dude?
like a little ego pick
Just a
me
little
up.
ego boost.
Yeah.
That's why it's so hard to treat.
When later asked about it, like what went wrong, he actually blamed it on the anesthesiologist.
How?
He said
Oh my God.
he said that there was a bad reaction from the anesthesia during the surgery.
And that made her blood vessels rupture.
And the
drop her.
anesthesiologist didn't catch it. She was giving the wrong doses, all of this stuff, and it was her fault.
Physically can't be the
At
anesthesiologist.
the time, though,
Systems don't.
at the time, they didn't know that. Like, there was only suspicions because everybody else was seeing this blood loss. But then now it's just his word versus their word, and you have to do an investigation into it, right?
Bill died. There was a problem with his penis, so it's obviously the lung doctor's fault.
Yeah.
Like, that doesn't make any fucking sense.
I know.
I don't get how you can do this for so long. And people are just like, well, I mean, he said it was the anesthesiologist.
You see, like,
and he
Yeah.
said he was really good at his
Yeah.
job. I don't know what else we can do.
He's messing someone, at least one person up a month.
he's
at
going
this
into
rate.
a career where they're not questioned a lot. They're not fired a lot.
Exactly.
These people
They
are
should
thought
almost be
of
questioned more than
as-
anyone.
They absolutely
They
should,
should.
be held
Yes,
to
they
account.
absolutely should.
I will say that with 1,000,000% confidence. As a medical professional who people
They
put
should
their
be
lives in
held
my hands every day.
accountable.
So they did an autopsy. They found the cause of death was, quote, medical miscalculation, which tells us nothing.
What,
It
I was
almost
about to
makes
say,
it,
what does
it
that
makes
mean?
it
What
still
the
sound like it's the
what does-
anesthesiast's fault.
Exactly.
That's
That's
it
exactly what it
still
sounds like to
sounds
me.
like it's the anesthesiologist's
Exactly.
fault, but it couldn't have been. It legally could. It literally could not have been the
So,
anesthesiologist's fault. Can't be. It couldn't have been his fault.
I don't know who.
It's not how it works.
It
It's not
could
how any of this works.
it could have been the ICU team. It could have been the other doctors. It could have been the anesthesiologist. But somebody
The ICU team is on the other side of the fucking room holding the wall up.
somebody said something because right before her funeral, the ME calls down. She's literally in the viewing area, and they go, "We're going to need to do a second autopsy."
Let me ask you,
Yeah.
legal hot potato. Is that a thing?
What?
Is like, I don't know what the fucking word is. I don't know anything about
Where you
legal
pass
stuff.
the blame.
No, you touched him last. You killed him. Legal hot potato.
That's like
How is he
clue
blaming
one.
it? Like, you touched him last. Your hands were around her fucking spine right before she died. You did it, dude.
I know.
But this guy was in the room. Well, what the fuck? It's not. Oh
Yeah.
my god.
Could they? I mean, when they did the autopsy, did they not? Didn't he pick
They-
a vessel or an artery or something?
They
He had
asked.
to have, for that much loss, he had to have hit an
Yeah,
artery.
he.
so can't they
yeah.
see that?
In the autopsy, yes.
Yes, if they're looking for it.
Well, shouldn't they be?
It'd
looking
be very
for it?
difficult to miss, I can tell you that.
Well, yes, and
But
they
I mean,
probably
shouldn't they? Yeah.
they probably did check the area. But the thing about it is that when you have like a checklist of places that you look and things that you look for when you do an autopsy, so unless you're looking for certain things, sometimes you don't see it in your
But-
initial pass.
They had the blood
You
pressure
would
dropping
think.
and the discoloration
You
of the
would-
legs.
So I
100%.
don't know.
and like,
Uh-huh.
I mean,
There would have
I'm
been.
not a doctor, but
No, but you're right. The blood's got to go somewhere.
It's
Yeah.
yeah.
So there would have been massive lividity. Lividity is a stage of the body. You've heard of rigor mortis. All right. Well, there's liver mortis. Liver mortis is pooling of the blood that coagulates inside the body wherever it's laying. So I assume she's in a hospital bed. If she had a laminectomy, she would have been either prone or right or left lateral recumbent, like laying on her side or face down for recovery.
Yeah.
So then all that blood is going to pool away from the site. It's going to pool on her belly, or it's
Yeah.
going to pool in her thighs, or wherever that it can go. Most likely the pelvic cavity, which can hold the most volume. So when they go to cut her open, she's not like a beautiful corpse that you found somewhere else that's been medically cleared for autopsy. It's not a cadaver lab. They didn't drain it and prep it for you.
Right.
You're going to cut her open and find a big old fucking clot.
Yeah.
and
And then you
the,
can trace it back.
the surgery was what'd you say, minimal invasiveness?
That's correct. They
Yeah.
make a...
So it's like your search pattern
is
isn't very
pretty
big,
small.
you
Yeah.
know?
Yeah.
Literally, they identified the lumbar or thoracic portion of the spine that needs to be repaired for a laminectomy. Like, and do you know which this one was? By the way, I meant to ask you that. Is it thorax or is it thoracic or is it lumbar? for her laminectomy. What were they repairing? Lower, upper, middle, what?
I believe it was the lower.
It had to be the lower. There you go. It's a pelvic cavity. That's it. So it's way down here by her back.
Yeah.
So they identified that.
Because she also had hip problems around it. So, yeah, it was the lower.
Now, I don't know enough about analyzing where you're supposed to cut based on what the fuck's going on, but I know that if they were going to find a spot to surgery, and they knew exactly, that's a verb, we were going to surgery you. If they were going to find a spot to do the surgery, they would immediately identify the landmark for that vertebrae, and they would cut a perfect box around it. They would literally just lay that bit back. And if it's supposed to be minimally invasive, they won't even do that, because that's considered majorly invasive. More than 3 cuts to the tissue to open up a portion, that's majorly invasive. But a single incision at that site, it would have been right above it.
No.
Literally right above the spine that needs to be replaced.
I don't know exactly. I didn't see on the reports exactly what was cut, but I do know there are some major arteries around that area, and he was literally working with the spinal cord. So,
but the posterior aspect of it,
yeah,
there aren't. That's what I'm saying. That's how fucking grossly incompetent this dude is.
Mm-hmm.
Again, I am not a surgeon. I have a very limited medical knowledge. I did study my A&P, though.
Yeah.
And I can
Anatomy
tell you right
and physiology,
now, the only thing poking up off the back of that is the bone.
Yeah.
You've got your vascular surgeons and your other people there to prep for you before you go in to make your site, and you just move those structures out of your way.
Mm-hmm.
And then all you're cutting is bone. Bill, when you eat a pork chop and you're cutting it with your knife, can you tell the difference between meat and bone with your steak knife?
Most of the time, yes.
And what happens when you are cutting meat and you recognize bone with your knife? What do you do?
Stop and move my knife.
Immediately move your knife.
Yeah.
If I told you to just cut a hole in a pork chop bone without touching the meat, how hard do you think that would be?
That would be
probably do
very difficult.
I believe in you.
You don't
believe
think
in you.
Thank you.
You don't. Okay, what if I told you that you have a rib in front of you, right? Everybody's eating a rib. The meat comes back off the rib a little bit, okay? So the rib bone's poking out, what, ½ inch? What if I told you I want you to use this pair of needle nose pliers to grab just that rib bone? What's the likelihood and probability that you would grab the meat instead of the rib bone?
Not a lot.
Not a lot.
Yeah.
Especially if I told you, also, the rib meat is alive and its kids are in the way. You would not miss
Oh my god.
if you gave a shit about humans at all. Am I right?
Ribs
Yes.
are delicious. So I might
He
mess
wants
up on
to
purpose.
do it.
He wants to.
He's playing with them at this point.
Yeah. And I so they did the second autopsy. They made it clear that there was not an allergic reaction of any kind, and then they re-ruled the cause of death as exsanguination.
Okay, all right.
There you go.
There
All
we
right.
go. Okay.
So Baylor Plano officials found that Duntsch failed to meet their standards of care and permanently revoked his surgical privileges.
Thank God.
Yeah.
And also, they gave a day pass to this sweet lady's family
I
to
know.
come to the prison and beat Duntsch every time they want to.
No shit.
Unsupervised.
Yeah. So the hospital initiated another peer review, but Duntsch resigned rather than face certain termination. To avoid the costs of fighting and possibly losing a wrongful termination lawsuit,
There it is, Bill.
the hospital officials reached a deal with Duntsch and his lawyers in which Duntsch would be allowed to resign in return for Baylor Plano issuing him a letter stating that there were no issues with him, that he did nothing wrong while he was at Baylor Plano.
Bill's about to have a stroke.
What the fuck
And they
is
only
wrong
did
with
that
people?
so he would leave. They didn't want their
Yeah.
record besmirched by this
Exactly.
man. And they didn't care enough about life.
Because that's
to-
4 people now that he
5. Jerry was 4, right?
They weren't all
yes,
at
5.
that
So,
hospital.
yeah.
But
They
yeah.
were.
Oh, they were.
So those
Okay.
5 were at Baylor Plano, and they didn't want 5 different families suing them. So instead, they offered him a deal and said, if you just resign, then we'll give you this letter of recommendation to wherever you want to go to next. Yeah.
I am pretty confident now with my
These
stealing of Subway
hospitals
sandwiches
deal
skills
with millions
that
of
I
dollars.
could be a neurosurgeon.
Yeah, you probably could.
And I can probably do it for a long time.
They would have been required to report him to the NPDB, that data bank, if he had been fired and not resigned.
That's the one we could check, right?
That's one we can check. However, because he resigned, they did not have to report him.
Good.
Should they still have?
God
yes.
almighty.
They didn't have to.
Then they would have had to admit that they let him do surgery there.
Exactly. They didn't have to flag him in any way. And he was also in no way reported at that time to the medical board.
I hope that the lady who made that deal lays awake every night staring at her ceiling and wondering about what a piece of shit she is.
Well, she makes a lot of money,
or
so
whoever. I don't know.
Yeah, she doesn't care.
I don't know who did it, but whoever they are, I hope. Yeah.
You've reached the end of our episode. All suspects are innocent until proven guilty in a court of law. Join Raven next time on the Sirens Podcast.
Do we have an outro? That's our outro, isn't it?